Dr. S. is a recent graduate of Tufts School of Dental Medicine. Practicing dentistry requires Dr. S. to examine the teeth, gums, and related issues of her patients and to develop plans for treatment. She often uses many different dental instruments and takes x-rays to evaluate their dental health. Depending on the procedure, Dr. S. must administer anesthetics to decrease the amount of pain experienced by her patients. You can see that Dr. S. has her wrist in an awkward position to obtain an optimal view of the patient's mouth. Dr. S. has to rotate her trunk to grab the tools that she needs. Dr. S. spends most of her day sitting in similar positions when she is doing dental procedures. Static postures can cause a decrease in blood flow to the tissues, muscle strain, and increased pressure on the muscles.
Dr. S. uses a 2-point or 3-point pinch to handle many of her dental instruments. This causes her to have forceful grasps at times. The dental instruments that she uses also vary in weight.
There you go.
You hold.
Just the holding position.
Good.
Gripping and closing on the tooth until it gets loose, and then it comes out. Now an exercise.
A patient of Dr. S. required several extractions in order to receive dentures. Dr. S. noted being in an uncomfortable hunched position for the majority of the procedure.
The eyes get bigger.
Dr. S. complained that she feels tingling sensations in her fingers sometimes when she's using the dental instruments. It is possible that these tingling sensations are a result of nerve compression from the edges of tools pushing into her fingers. The dental drill causes hand-arm vibration, which can reduce blood flow and sensory response. We also noticed that Dr. S.'s procedures often require repetitive motions that involve flexing and extending the wrists and fingers for long periods of time.
Relating a root canal where we have tiny hand files that we rotate within the tooth root. A lot of up and down motions, a lot of tiny rotations here.
We noticed that Dr. S.'s chair causes her to bend forward a lot when working and does not contain armrests, resulting in awkward posture.
Elbows in. Well, I'm just going to bring you down.
We recommended that Dr. S. should look into using dental instruments that are more lightweight and larger in diameter to prevent hand cramping and muscle fatigue. Research has shown that using silicone instruments that were lighter and larger in diameter versus using stainless steel instruments enhanced grip and pinch strength, improved hand comfort, and reduced hand fatigue.
File, putting it in the hole, give it an idea.
We recommended that Dr. S. invest in an adjustable chair with a seat pan that has textured material to prevent any sliding that may occur and result in an awkward posture. A chair that is adjusted to the proper height could help to eliminate strain that is placed on the back.
We also suggested that Dr. S. get a saddle-type stool that contains armrests. Saddle stools have been found to place the pelvis in a more neutral position. Armrests can help prevent carpal tunnel syndrome by giving support to the arms and wrists during procedures.
We recommend that Dr. S. alternate her positioning frequently to reduce the occurrence of muscle fatigue and pain that result from maintaining a static posture for a long period of time. We also suggested that Dr. S. should take frequent stretch breaks to increase blood flow to the muscles, to improve range of motion, and to decrease any tightness present in the muscles.
For Dr. S.'s awkward wrist positioning, We recommended that Dr. S practice hand stretches at least 3 times per day in between seeing patients to minimize the tension that results in her wrist and hand muscles. We recommended that dental instruments should be within easy reach so that Dr. S does not need to continuously rotate her torso or bend her trunk to reach for her tools.
We also suggested that Dr. S purchase hand strengthening equipment such as hand grips or putty, which are available in various levels of resistance. This can improve her grip strength for procedures such as extracting teeth where sustained grasp on tools is necessary.
Also, to just help with the dexterity, we use the grip strengthener.